Okay, a very good afternoon to all, and we'll start the quiz now. And I would first like to thank the organizers of Karnataka State Ophthalmic Society Conference Organizing Committee for inviting me for this. And I would say that this is a promotion for me because all the last 5 or 6 years I have been conducting a PG quiz, and this time I have been promoted to take up a quiz for the faculty. I'm so happy about it. So I'm just putting a Google link for all of you in the chat box so that you can put up your answers on the chat, on the Google form. Okay, so just give me 1 minute. You all will have to access this Google form which has come in the chat box. Are you able to see that? And please enter some mandatory information about yourself so that we can know who has got the first prize. Okay, can someone just tell me whether the form is accessible? And also please fill in the details there. There are 3 main details: your name, your email ID, and your phone number. These are required because we will have to call you back to say that you have won the quiz. So we need those details there. Okay, thank you, Madhuri, for responding. And I'm just starting in the next 2 or 3 minutes when I can almost be sure that everyone has typed in the names and the other details like email ID and phone number. And immediately after that, I will start the quiz. Okay, so I assume that you all are done. If there's anyone who has not added the details in the Google form, please put up in the chat box so I will know that it's not done. So until then, I will start giving you a brief intro to how the quiz is going to happen. There are 2 parts in the quiz. The first part will have 3 short sessions. Part 1, yeah, I will not start immediately. I'll wait for a few seconds and then start so that everyone can join and add the details. So there are 2 parts in this. Part 1 has got 3 small components or portions. And as you can see, there are 10 questions of 10 marks each. And in the second one, there are 10 questions of 20 marks each. And in the last one, there are 5 questions of 10 marks each. So since we are using Google form, the limitations of this quiz is that we cannot interact, but then that's how it's going to be in the virtual quiz. And once again, we have part 2, and we have a similar layout of the quiz questions there also. So if you are done with the entries, then we will go for the first round. The Google form, I'm putting it again in the chat box for anybody who has joined late. They can access this form. Please make sure that you enter your name, email ID, and phone number accurately. Rohit, are you done? Rohit Agrawal? Yes, we'll wait. We'll wait for a minute. No issues. If anybody else has any problem with filling up the form, do let me know so that we can try to resolve it before we start. So I request everyone to fill up the mandatory details and be ready for the question number 1. And mind you, the questions are going to be very simple. It's not going to test the knowledge or anything like that. It's not a PG quiz where we bombard with most complicated questions. It's going to be a lot of fun. So just like we have our YEN-OPH department, Yenepoya Ophthalmology department, this is going to be fun in ophthalmology. So I'll put up the next slide. If anybody has still not finished, please put up in the message box so I will know. So the first part of the quiz is a simple quiz like the KBC, Kaun Banega Crorepati form type. There are 10 questions and each question will come on a separate slide, one after the other. For each question, there are 4 options. A, B, C, D is written on them clearly, and the same thing is also written on Google form. So you'll have to select the single most appropriate response. You have 25 seconds to respond after the question is read out. There's a timer on the slide which you can refer to. Make sure you match the question response numbers, because if you don't, then your questions, even if they are the responses are correct, if they are being marked against another question, it will be considered as wrong. So you'll have to be a little careful over there. So are you all ready? Is anybody not ready? Just put up in the message box, chat box, so I will know. Okay, so there are no messages. So I assume that everyone has filled up the form with the mandatory details. So I start, here we start. And this is the first question that's coming your way. And it's, I'm saying again, it's a very simple quiz. So the first question, this is a three-dimensional representation of which ocular structure? Is it A, fovea, B, cornea, C, posterior capsule, or D, ciliary process? A very easy question, and your time starts now. So first question has to be a simple question. So this question is dedicated to the artist who has drawn it so well, and your time is up. I hope you all have marked against the correct question number. And now we go to question number 2. This is your question number 2. The axon filled, sorry, the mistake is there, loop refers to which of the following? A, pigmentary nevus or melanoma. B, long ciliary nerve. C, long posterior ciliary artery. Or D, aqueous vein. What is it? The Axenfeld loop, what does it refer to? Your time starts now. It's a very common normal finding, and sometimes we feel that it's some abnormal thing on the eye because the patient is complaining. So what is it? And your time is up. Please mark against the right question number. We go to question number 3, and this is it. What is that common term used to describe these two different conditions? The first picture is showing a cornea, and second one a fundus. So what is that common term? A, starry sky appearance, beaten bronze appearance, scrambled egg appearance, or is it D, marbled appearance? Your time starts now. Two entirely different conditions, completely different structures, but the description term used is very common. So what is that term? Your time is up. We go to now question number 4. Please note the question number correctly. Which of the following is a prolate surface? Is it A? Look at the image. Is it B? Or is it C or D? So we often talk about prolate surface and all that. Now you'll have to tell us which is the right answer for this question. Please mark against the right question number. Your time is up. We go to the question number 5 now. Which of the following images refers to lesions in age-related macular degenerations? You'll see 4 different images. Tell us which of it refers to lesions in the age-related macular degeneration. This is A. This is image B. This is image C. And this one is image D. Your time starts now. Everything to do with retina, macula. Okay. So we go to question number 6 now. Biofilm theory is associated with which of the following crystalline conditions or crystalline conditions? There are 4 crystalline conditions, again affecting different parts of the eye. And these are the ones. This is A. This is also a crystalline condition, B. This also is a crystalline condition affecting a different part of the eye. And these are crystals seen. Which of these is associated with biofilm theory? All are crystalline conditions. Your time is up. We now go to question number 7. Which of the following is a sign seen on spectral domain OCT? So these are all double signs. Let us see what they are. A, double bubble sign. B, double hump sign. C, double ring sign. And D, double layer sign. We know all these signs, but which of this sign is seen on spectral domain OCT? Few more seconds. A little confusing, is it? Or not? Okay. We go to question number 8 now. Which of the following is true about situs inversus? Okay. A, the disc is located temporal to the fovea. B, temporal retinal vessels are oriented nasally before passing temporally. Or C, temporal retina is supplied by the nasal retinal vessels. Or D, the whole retina is supplied by cilioretinal artery. Little confusing to me initially, but then you all are experts, I'm sure. Situs inversus. I restarted the time because this is a little confusing. Okay, so we now move to question number 9. The next question is, which of the following is not referred to as Muller's muscle? So we know about Muller's muscle, and the options are A, annular portion of the ciliary body muscle. Is that a Muller's muscle? Or superior tarsal smooth muscle? Or C, pretarsal orbicularis muscle? And D, smooth muscle over the inferior orbital fissure. The question is, which is not referred to as Muller's muscle? That is, 3 are Muller's muscle, 1 is not. You have to identify which one is not a Muller's muscle. Your time starts now. I hope you all are enjoying. Can't hear anything from you. Then assume you all are enjoying the quiz. The time is up. We go to one non-ophthal question. Too much of ophthalmology. So we'll just come out of ophthalmology, but something related to the last question. We wrote Muller's with these 2 little dots on U. So what are the 2 little tiny dots on the letter U seen in the name Muller called? So this is grammar or literature. 1, is it called till, or is it called umlaut, or is it called cedilla, or is it virgule? Your time starts now. This is of ophthalmology. So we are coming to the end of the first section of the quiz, and we are done with these 10 questions. I hope you all are enjoying. If anybody is willing to tell on mic, yes, I'll be very happy to hear you.
Yes.
No? Yes. Thank you. I heard one. Thank you so much. So we go to the next part now. Thank you. We go to the next part now. And this is something to do, test your memory. So sit straight and be ready to look at the images and try to remember them. So there are 10 questions again in series. Okay, on each slide, there'll be 6 images which will be projected, one after the other. So there's one slide on which one image will come and go, another image will come and go, like that. 6 images will come on the slide, one after the other. Try to remember those images. Later on the next slide, you will have 4 options, A, B, C, and D, one of which refers to an image which is not shown at all. For example, I show one slide with Mangalore, Bangalore, Belgaum, Hubli, Mysore, and say Davangere. These are the 6 images I show. The next slide will have 4 options. That is, it will have Mangalore, Belgaum, Mysore, and Chikbalapur. So your answer has to be Chikbalapur, which was not shown in the first slide. So it's a very easy thing. And let's go ahead with that. Make sure you mark the question response matching. You do it very well so that you don't answer another question. Okay, so you have 20 marks for this. So there's no negative marking, but you have 20 marks for this because it's not only testing your knowledge, but also memory. So we go ahead with the first question. So are you all ready? So these are series of iris lesions. So many commonly seen iris lesions, which will appear on the screen one after the other. 6 images will appear. Try to remember them. So your images are here. This is 1, 2. Remember. This is 3. This is 4. 5. And this is 6. These are the 6 images that you just now saw. This is a quick recap. Remember, okay? And now my question is, which of the following iris lesion was not shown in the series? 1, ectropy on UVA. B, iridodialysis. C, iris atrophy. Or D, rubeosis iridis. Which was the image not shown? Your time starts now and you have around 15 seconds for this. Yes, your time is up. We are ready for the next. Why this round? Because we often ask our PGs to see the case and come and present to us. And when they forget some findings, we keep asking them, how can you forget such an important finding? So we are trying to test ourselves now to see how much we really remember of the 6 lesions that are shown. So those were iris lesions. Let's come to disc lesions. So you're going to see some 6 disc lesions. Try to remember them. Your images are here. This is 1. This is 2. 3. 4. 5. And 6. These were the 6 images. A quick recap. That's all. And now the question is, which of these optic disc lesions was not shown in the series? Was it Adrans hemorrhage, morning glory syndrome, optic disc pit, glaucomatous cupping? Which one was not shown? Your time has started. If you all are sitting together, don't discuss. I can't see you, you can't see me. So we have to just be honest. Your time is up. I hope you got that right. Next question, that is question number 13. Now these are series of cataracts, different forms of cataracts, morphological forms of cataract. Try to remember them. Take a deep breath and look at this slide. 1, 2, 3, 4, 5, and that's the last one, 6. And this is a recap. Okay, fine. All set? Which of these images was not shown? Was it Morganian cataract, Christmas cataract, lamellar cataract, or sunflower cataract, which was not shown? Your time has started. Few more seconds. And your time is up. That was question number 13. Next question is question number 14, and that is some corneal conditions. Okay, so let's see how good we are with these corneal conditions. 1, 2, 3, 4, 5, and the 6th image. And this is a quick recap. Quickly remember. And the question is now, the faster I give, you'll get a better question. So I'll just delay a bit so that you start forgetting the images. That's cheating. Okay. The options here are A, Kera rings, B. Corneal tear. C. Marginal keratitis. D. Dendritic keratitis. Which one was not shown? Time is up. Yes, I hope you all remembered it correctly. Question number 15. Again, we have one non-ophthal, but related to eyes. Okay, though it's not ophthal, it's related to the eyes. And carefully remember the names of these movies. 6 movies, all based on the eye. And that's 6. Now I'm doing this very quickly. And the movie which was not shown was it A, Aankheं, B, Sand Ki Aankh, D, Aankhon Dekhi, and D, Teesri Aankh. Time's up. We go to the 16th question. Now, some series of symptoms depicted in the form of images. These are series of symptoms. 1, 2, 3, 4, 5, and 6. These are the 6 for you. And the question options are A, photopsia, B, colored halos, C, diplopia, or D, central scotum. Which one was not shown? I think the quiz is getting easier. Few more seconds. And your time is up. We go to question number 17. Now, these are some common ophthalmic tests we do in the OPD, and we are seeing them here. 1, 2, look at them carefully. 3, 4, 5, and 6. This is a recap. Now check out which were not shown. A, Bruckner's test. 2, B, Hirschberg's test. C, Siddle's test. Or D, corneal sensation test. Which one was not shown? That was question number 17. We go to question number 18 now. These are some instruments, and these are the 6 images. This is 1, 2, 3, 4, 5, and 6. And this is a recap. And the options are A, Johnson buds, phaco probe, iridectomy scissors, Aruga's capsulotomy forceps. Which one was not shown? Time is up. 2 more questions to go in this. And you want to take a deep breath before we go for the logos. We have some ophthal related or health related logos which are coming up now. Let's start. This is 1. This is 2. This is 3, 4, 5, and 6. I'm taking some time here so that you all forget. Okay, these are the options. A, World Health Organization. B, National Program for Control of Blindness. C, Vitreoretinal Society of India. And D, Eye Bank Association of India. Which one was not shown? Time is up. And the last question in this series is something that I like so much, animals, birds. So I'm going to show you a series of animal eyes. Okay. And you are going to identify them and tell me in the end which one was not projected. So your options are here. I hope you all are animal lovers too. Carefully look at them. They might look alike, but if you know them, you know them. That's all. So since this is non-optal, I'm going to let this image stay for a little longer while for you to identify a couple of eyes which are a little more difficult than the others. Yes, we move to the next, the question related to it. And the options are tiger eye, elephant eye, spider eyes, or frog's eye. Which one was not shown? Okay, and time's up. So we come to the end of 2 sessions. The first one, simple quiz, and the memory round. We have something very, very interesting now. This is going to determine the prize also, because in this next round, there are 5 questions which are going to all be projected at the same time on the screen. This is like rapid fire. You'll have to be very fast and respond to all the 5 questions and submit. It's very important to press the button submit. Only then your timer will stop. That means that you'll be answering in that number of minutes or seconds. So the earlier you press the button submit, the better for you. There are no options available here, no ABCD options available here, but you have to type the answer. So if your answer is Uma Kulkarni, you have to type Uma Kulkarni without any spelling error. So Uma Kulkarni, it should not be Kulakkarni. It has to be Kulkarni. If it is ophthalmology, it has to be OPHTHALMOLOGY. It cannot be OPTH like our students write. So any spelling mistake will be considered as wrong response. So be very careful, but at the same time fast, because this is where you can score over your competitors and get exciting prizes that COSCON is waiting to give you. Okay, so there will be a session winner also. This is the first session. There will be a session winner. The second session, there will be a session winner and overall winner also. So you could get even 2 prizes. So make sure you're writing the answers against the correct question number. So are you all ready? I hope yes. And these are the 5 questions, 21, 22, 23, 24, 25. Okay. And correct spelling has to be written. There's no option. You have to type in the correct spelling, and caps lock and all doesn't matter. I've given all the options there. So as long as the spelling is correct, your answer will be considered correct. Okay. So these are the 5 questions. 21, surfer's disease. It's a 9-lettered word. Lazy eye, 9-lettered word. Belladonna alkaloid, 8-lettered word. Blue vision, 9-lettered word. And iron all over the eye, 9-lettered word. That's 25. So you just have to submit. Once you submit, this round will get over for you. So you can gain time in this, points in the form of time, if you do it fast. Okay, so we'll have to see how many people have responded. Just referring to the Google form. No responses yet. Yes, we have started getting responses. Very good. Come on, all of you, type in the correct spelling of the word and respond. Good. Getting lot of responses, and so far the highest scorer is around 280 or close to 350. Very good. Got many responses. So the average score so far is 269 out of 350. That's really good, and I think you will know your scores. So we are steadily getting responses. So far 15 responses, that's really good. And just wait for a few more seconds before I give you the next form, that is for the part 2. Be there. More interesting questions will follow in the round 2. So I'm going to close my presentation here, this presentation, because I will have to move to the next presentation. So by the time I'll get ready, please submit your responses. So I'm going to stop sharing this screen and we'll go to the next screen. By then, I also have to give you the form for the second round. I'll just do that 1 minute. And for part 2, you'll have to once again write those details, which is mandatory because we will not otherwise know who participated. So the form for the part 2 has been given here. Please click on the form and enter the mandatory details, your name and phone number and email ID, just like you did for the first round. We are still not closing the responses. We'll be closing the responses for the first round. And if you have not participated in the round 1, you can still participate in round 2 because there's a separate session winner for round 2. For all those who logged in late or could not attend the first part, can still, yes, I'll send the link again. I'm sending the link again in the chat box for part 2. Please log in. Please click on the link and enter your details. Even if you have not come for the first round, and that's the reason I made 2 rounds for anybody who could, joins late. So you can have a session 2 winner, session 1 winner, and a combined winner. So there are 37 participants, or 37 or 38 participants, and we have got around 27. Maybe few of you joined late, and that's why could not. But then we will close that, and at the end of the quiz, we'll try to give you the session winners if possible. Okay, so shall we go to round 2? I'll share the round 2 presentation now. Any feedback? Please put up on the Google Forms so that I know what's going well and what's not. Okay, this is round 2. Please fill in the mandatory details and then we'll start. As you know, just like the round 1, we have 3 different parts, but this time entirely different forms of questions. Nothing is going to repeat. Okay, this is, and we are starting there. I hope you all have all entered the mandatory details by now in the second form. Yes, now it's moving. I don't know, sometimes this technology. Okay, this is round the second part, in which you'll have round 4, 5, and 6. So we finished at question number 25. We are going to start question number 27. OnePlus is writing something on my screen. Okay. So this is about finding faults. So we are all mostly teachers or parents or friends. We all like to find faults with each other. Let's see how good we are in finding faults. So there are 10 questions here, and we play cards also at home, right? So this is a card game. There are 5 cards going to be displayed for each question. A, B, C, D, E cards. Okay. And there are options which are available about certain common thing. For example, if it's about COSCON, it will say that the COSCON is being held virtually. The second option will be COSCON is being held at Bangalore, something like that. Some 5 cards regarding COSCON will come there. One of which is wrong. So you'll have to identify which information is wrong. Okay, and click it on the Google form. So that's what you need to do. Please make sure you match the questions and responses well. Okay. Yeah, there are 5 cards which will come. A, B, C, D, and E. There are 10 such questions. Again, there are 10 marks for each question. So shall we start? Can somebody just say yes so that I start? Anybody?
Yes, ma'am.
Yes, perfect. Thank you so much. So we start here, part 4. And this is the first question. How to take this off? It's okay. Okay. This is, we know this person very well. This is Alvar Gulstrand. And the next question is all about him. Okay. Find the faulty card. There are 5 cards which are going to come over here. They are about Alvar Gulstrand. And the options are here. These are the 5 cards. You have to identify which is the wrong or faulty card. A is the only ophthalmologist to win the Nobel Prize. B, the only one to receive Nobel Prize for work in ophthalmology. C, he said, learn from yesterday, live for today, hope for tomorrow. The important thing is not to stop questioning. D, he was called the gentleman with the lamp. And E, his primary work was on dioptrics of the eye. You tell us which one is the faulty card. Your time starts now. So, one of the pioneers in ophthalmology, a lot changed in diagnosis and also management depending on his work. And your time is up. Okay. We go to the next. Question number 26. Again, we have some pioneers in ophthalmology. It's going to be a question on these people. Okay. You don't have to identify them right now. And these are all. The question, the cards are like this. 1, 2, 3, 4, 5. A is Jules Gonin was a pioneer in retinal detachment surgery. Von Graffe was the first one to introduce trabeculectomy for acute glaucoma. C. Sohan Singh Haire was a pioneer in ocular and optic nerve circulation. D. Robert Stegman introduced viscocanalostomy. And E. Sir Harold Ridley pioneered intraocular lens surgery. Now you tell us which is the faulty card. One day somebody should have a quiz with all our names here. So and so did this and so this. I'm sure many of you, your names will be there in quizzes in future, but not as a faulty card. Okay, so that was question number 27. We go to question number 28. Okay, this is all about scotomas. Okay, everything about scotomas, but I'm trying to confuse you all with some wrong answers. So let's go to the card, and the cards are these. Okay, listen carefully. Roving ring scotoma is seen in those wearing aphakic spectacles. Annular or ring scotoma of glaucoma surrounds the fixation and blind spot. Third one is ring scotoma of retinitis pigmentosa surrounds the blind spot and fixation. D, enlarged blind spot is seen in papilledema. And E, junctional scotoma is named after trachea. Which one is the wrong or faulty card? Your time starts now. Few more seconds. So many rings in ophthalmology and so many ring scotomas. Few more seconds and time's up. So we go to question number, that was 28. Now we go to question number 29. And what am I seeing? Sometimes patients complain so many weird things. And let's try to see those weird visual problems. Okay, so these are the 5 cards for you about confusing visual problems, at least confusing to me. And the cards are like this. Palinopsia is persistent recurrence of image after the object is removed. Pulfrish phenomena is seeing ghost images of moving objects. Scintillating scotoma is bright shimmering zigzags seen in migraine. Or redox phenomena, the ability to perceive visual motion in a blind visual field. And dysphotopsia, unwanted streaks, starbursts, flickers, typically after cataract surgery. Which one is the faulty card? Your time starts now. One of them is wrong. Time is up. Was that confusing? It's always confusing for me. Okay, so we go to the next question, that is question number 30. That is innovation line. New drugs in ophthalmology. So many new drugs are coming every day. I have tried to find some in the last 2-3 years which have been released or talked about. And these are the drugs. 1, 2, 3, 4, 5. Reproxalap is a new antimicrobial drug. Brolucizumab is an anti-VEGF drug. Netersudil is an anti-glaucoma drug. Apremilast is a drug for uveitis, and Cenegermin is a new drug used for neurotrophic keratitis, all tongue twisters. So your time starts now. Which one is the faulty card? Your time is up. And that was question number 30. Next, question number 31. This is all about colors, as you can see, or dyes in ophthalmology. Okay, so your options are here. Listen carefully. Sodium fluorescein is used in applanation tonometry. Lissamine green is used in dry eye evaluation. Brilliant blue G is a stain used for internal limiting membrane. No dye is used in CT angiography. And the last one is the dye used in anterior capsulotomy. Which of these is a faulty card? Look at them carefully, read them carefully, and answer. Okay, sorry. The timer didn't work, that's all. Okay, no problem. Okay, so assume the time is over and you have got the right answer. So we go to question number 32 now. Something about fake terms in ophthalmology, not fake ophthalmology, but fake terms in ophthalmology or pseudo-ophthalmology. So we have so many terms, confusing terms, and these are the 5 I have chosen for today. Pseudodendrite is seen in varicella zoster keratitis and lacks terminal bulbs. Pseudofovea, a new area in the retina that takes up as the fixation point. Pseudooperculum, seen in stage 2 macular thickness, full thickness macular hole. Pseudogerontoxon is seen in axon-filled rigor anomaly. Pseudotosis is seen in the presence of microphthalmos and phthisis bulbi. Which of these is the faulty card? Your time starts now. That was really easy, according to me. That was question number 32. We go to question number 33 now. This is where did I come from? The words are saying this. And some word origins in ophthalmology. Okay, so these are the 5. Coloboma means curtailed or mutilated. Zonule, belt or a ring. Gutta is a drop. Caruncle is a corner. And schisis is a split. Which of these is wrong? This is question number 33. Your time is up. And we go to the next question. That is question number 34. These are about some canals in ophthalmology. In the eye. And the named canals. So somehow I'm very fond of these terms. Canal of Petit is, it surrounds the zonules. Stilling's canal is the hyaloid canal. Schlemm's canal surrounds trabecular meshwork. Hanover's canal channels within the trabecular meshwork. And Dorello's canal is the tip of the temporal bone which contains abducent nerve. Which of these is the faulty card? Names often confuse us. But quiz is all about knowing everything, including names of people, including the correct spellings. So we go to question number 35. That's the last in this round. And I'm not going to read this question. You're going to read it yourself. Okay. So all about color and vision. I'm not reading the question. Okay. Options. Your time starts now. Which is the faulty card? Quick. And that's the end of this round. 35 questions. I hope you all got that last question right. I wish it was an offline quiz. I would have seen all your expressions and it would have been more fun. Okay. And this is the next part of this round. And we are going to extend this session up to 2 o'clock because we started very late. I hope the organizers don't have any problem with this. So the next is again 10 questions, 10 images are there, 4 options for each, and this is pure ophthalmology. So let's start with that. There are 20 marks for this, so get them right. Oh, sorry. Yes, it's 20 marks, okay, not 10 marks. Okay, so we start here. This is question number 36, spot the diagnosis. What is it? There are 4 options. A, microphthalmos with cyst, B, anophthalmos, C, cryptophthalmos, and D, nanophthalmos. Look at the image and tell us what the answer is. Okay, your time is up. Now we go to the next question. Spot the diagnosis here. And these are the options. A, central artery occlusion. B, central retinal artery, cilioretinal artery occlusion. C, central retinal occlusion with cilioretinal spare. And D, ophthalmic artery occlusion. Kindly mute yourself. Okay, few seconds more. And you score 20 because these are easy questions. And if you don't know, you lose those 20 questions, 20 marks. The time is up. We go to next question, question number 38. Spot the diagnosis. Is it A, squamous cell carcinoma, B, basal cell carcinoma, C, retinoblastoma, or D, sebaceous gland carcinoma? Your time starts now. That's easy. That's question number 38. Next, question number 39. And this is it. Spot the diagnosis. I think without options also we know this answer. A, is it infantile esotropia? B, esotropia with inferior oblique contraction, intermittent esotropia, or accommodative esotropia? Your time starts now. Easy question, 20 points. That's it. Go to question number 40. Look at it carefully. Spot the diagnosis. Is it left lid retraction, or right blepharospasm, or right Horner's syndrome, or right oculomotor palsy? We need a keen eye for this. Few more seconds. I wish I could see you all and hear you all, but that's not possible. Time's up. Question number 41. Spot the diagnosis here. Is it orbital rim fracture, white-eyed blow fracture, blow-in fracture, or blow-out fracture? Few more seconds. Almost coming to the end of this round. Another 4 questions, correct. That's question number 41. Question number 42. Identify this. Is it A, keratoglobus, B, keratoconus, C, Terrien's marginal degeneration, or D, pellucid marginal degeneration? Few more seconds. That's question number 42. Please mark against the right question number. Question number 43 is this. This patient had sudden onset diminution of vision. Okay, look at the image very carefully and tell us what's the possible diagnosis. Is it white dot syndrome, Best macular dystrophy, solar retinopathy, or chloroquine maculopathy? Few more seconds. Time's up. To the next question, 44, spot the diagnosis. Look at the B scan. A, is it posteocephaloma? B, retinochoroidal coloboma? Or is it optic disc coloboma? Or is it morning glory syndrome? Time starts now. Very easy question. Few more seconds. And time's up. We come to the last question of this round. And that is here. Spot the diagnosis. OCT. A, is it cystoid macular edema? B, chronic central serous retinopathy. C, vitelliform dystrophy, macular schisis. What's the diagnosis? And wait for the next round, which is going to be my favorite round, before we complete the quiz. Few more seconds. Time's up. Wow. This is I'm going to test the art sense in you or the poetic sense in you. Okay, so there are 5 questions which will be projected on the screen one at a time. You have to think like John Keats or whoever your favorite poet is and respond. So there are no options. Once again, you have to type the answer like the first round end 5 questions wherein you had to type the answers, synopsis and all that. Similarly, you have to type the answers here. Any wrong spelling will not be considered for marks. Okay, so you have to please make sure that you match the questions and answers properly. So here we go. This is a test of my poetic skills also. So this is the first one. I hope I'll be able to convince you with the answers. Okay, the first one is a 5-lettered word. Guess me. Who am I? It's whoever it is saying, I widen with joy and shrink when dull. I'm rather a bit chanchal, but never ever belittle me, for the whole big world has to pass through me. Who am I? Think and type there. I haven't put the timer for this somehow, so I'll just guess the time and finish it. Okay, I'll read it again and then I'll close. I widen with joy and shrink when dull. I am rather a bit chanchal, but never ever belittle me, for the whole big world has to pass through me. I hope you all got it. Yes, and yes, that's 30 seconds. So we'll move to the next. Okay, so we go to the next, that is guess me. Answers will give later. Yeah, you'll have to write the answers. You'll have to type the answers there. Okay. Yes, yes. All are ophthalmology related. Okay, they're all in the eye, related to the eye. Okay, related to ophthalmology. So this is the second one. This is 47. I am but a single cell. Who am I? Can you tell? While on the eye a veil you wear, I make my happy home there. The problem is in the solution. A good solution is the best solution. Little confusing, but I think you'll get it. I'm reading it again. I am but a single cell. Who am I? Can you tell? While on the eye a veil you wear, I make my home there, happy home there. The problem is in the solution. A good solution is the best solution. So,
single cell.
don't discuss. Just type it. Okay, the number of alphabets is 12. I think that gives you a clue too. Okay, 12 alphabets. So we close here. We go to the next question. I hope you all got it. Question number 48. This is again 15 alphabet. Okay, I'm reading it now. They dread to think and talk of me. They do everything right. They clean their hands and blades and more to keep me far from sight. And if and when I do arrive, they give their biggest fight. With grit and hope, they prove to me it's not the end of light. I'll just repeat it. They dread to think and talk of me. They do everything right. They clean their hands and blades and more to keep me far from sight. We don't want to see it. And if and when I do arrive, they give their biggest fight with grit and hope. They prove to me it's not the end of light. I hope you got this also. Number of alphabets is 15. And you can see the image on the right. So we stop here. We go to the next question. Question number 49, the last but one. Okay, this is again, there are two words in this. You'll have to put one single space between the two words when you type. Okay, no comma, just put, suppose the answer is Uma Kulkarni, Uma space Kulkarni, no comma, full stop in between. Okay, I live in the world of light and hues, but never a flicker I see. I serve as a messenger of the higher God, but in the dark I live. Who am I? So this is a two-worded answer. The first word has 5 alphabets and the second has 4 alphabets. You may get 2 answers in your mind. Both are right. I'm giving you another 10 seconds, 10 or 15 seconds, and then we'll stop. I'll just repeat. I live in the world of light and hues, but never a flicker I see. I serve as a messenger of the higher God, but in the dark I live. Who am I? I hope you got this too. And we'll go to the last question of this quiz. Again, a poetry, a small one, and a tough attempt. Okay, this is a word which has 9 alphabets, and it says, sometimes here and sometimes there, the shaky world no good to stare. To any one side, I shake and slide. When I'm upbeat, it's not too sweet. Hold me, contain me in the glass or needle thread. My seesaw life's a jerky bed. There are many, many clues in this, and I hope you got it. There's a chat message. Much fun. Thank you, Shailaja. I hope you all got it. And then we close and we'll get back with the results, maybe through COSCON. And if there's any particular question for which you needed an answer, I'm ready to respond. So we have already got, my God, a lot of responses already have come here. And I'm stopping the screen share. Yeah, 23 responses. That's nice. Yes, we'll be sharing the results and I hope you enjoyed. Is there any particular question whose answer you needed? I'll be able to give because there's no time for running the whole answers. Thank you. I'm seeing a lot of messages. Thank you, Rashmi. Thank you, Madhuri. Thank you, Shailaja. Thank you, John Davis. Thank you, Gargi. Thank you, everyone, for being with me. Very nice quiz. Thank you, Sneha. Thank you, Yamuna. Yams, thank you so much. And the results will be out very soon. So we'll have to move out of this hall to make way for the next session. So thank you all. Bye. I only wished it was face-to-face quiz, not in our hands. And I firstly thank COSCON, Dr. Ellen Kumar, and the whole team who believed in me for the 7th year and gave me a quiz for this session. And this time it has been a quiz for the staff members and not only for the PGs, and that made it a little different. My approach also was different because usually we try to find out how much the PGs have answered, but this time it was more than that. I thank all the participants for taking part and gracing this function. Without you, this wouldn't have been possible. Thank you, Vijayapai ma'am. Thank you, everyone. And I sign off from here. Thank you.
Thank you, ma'am. Thank you.
Thank you. Bye.